the worst thing a parent ever wants to hear about their kid is when they're not even born, and which just just days before the end of May, in Dakar, Senegal, a fire happened to the neonatal unit of the hospital where 11 babies, newborn babies, were killed in the fire, which the hospital, I mean, Abdul Aziz Sid Dhaka Hospital, the transport hub of Tivanduan, which was caused by a short circuit, apparently, according to the Senegalese politician Diop Sy. Just before the midnight, the country's president, Macky Sall, said on Twitter that 11 infants had died in the blaze after he expressed his deepest sympathies for the mothers and their families. Which he says, I have just learned with pain and consternation of the death of 11 newborn babies in a fire that occurred in the neonatology department of the Abdul Aziz Dabka Hospital in Tivaouane. And of course, the time period of the mothers carrying the children in their stomach, and then they're pregnant. They ended up at the hospital, and unfortunately, a short circuit caused the fire happened, and Abdul Aziz say that the hospital, and fire happened and babies dead, and it would be the worst thing ever happened. And 3 babies were saved. So according to the local media, Abdul Aziz Dabka Hospital was newly inaugurated. So the health minister Abdoulaye Diouf Sarr, who was in Geneva in a meeting with the World Health Organization, said he would return to Senegal right away. He said on the radio, "This situation is very unfortunate and extremely painful. An investigation is underway to see what happened." So the tragedy that happened in Tivaouane happened after several other incidents had happened in other public health facilities in Senegal, though not the first one. Which shows a problem between urban and rural areas in healthcare services. So northern town of Linguère in late April, fire happened at a hospital. 4 newborn babies were killed in that fire, which the mayor of that town has cited electrical malfunction in air conditioning unit. So it had to do with electrical function and air conditioning. Another one happened, which happened in a nation that mourned the death of a pregnant woman who waited in vain for cesarean section, a C-section. So the woman who that name was Astus Soknam, she had arrived at a hospital in the northern city of Lugan in pain, and the staff had refused to accommodate her request for a C-section, and since it was not scheduled, she ended up dying on April 1st, 20 hours after she arrived, and after the hearing of Astu Sokna's death, there was a lot of outrage across the Senegal on the state of the Senegal's public health system, and also Health Minister Diouf Sars has said the health system, they could have said this death could have been avoided if they did a better job. And 3 midwives, when as soon as Sokna had died, which there were the people who were like refused to on duty that day. On May 11th, at the court of Luga, there was the 3 midwives were sentenced suspended imprisonment for failure to assist a person in danger in connection to her case. Senegal director Seydi Gassama said his organization had called for an inspection and upgrade for neonatology services in hospitals across the Senegal after the 4 babies dying in that fire in Dinguer. And there's also urge for the government to set up an independent commission of inquiry to determine the responsibility to punish the culprits, and no matter what level of they're in the state. And lawmaker Mamadou Lamine Diallo had a tweet on response to the Tio Balang and the fire that the hospital that killed 11 babies, and condolences are given out and action is required, and hopefully Senegal the health system actually does something better. Even who's the director of health, even Diouf Sarr even called out the people at the hospital, the health system, to actually do better. And it's unfortunate that all these babies have died at these hospitals. After just being born, because of short circuit problems or the air conditioning problems that failed to work. unfortunately, the fire that unfortunately took the life of these babies who could have grown up to be great citizens of Senegal, but lives lost too early. And this is why healthcare is, really need to improve. Even for babies, they don't even know how to they were just born, and unfortunately we can't do anything about that because you know it happened too fast. Hopefully Senegal does a better job next time.